Assalamualaikum warahmatullahi wabarakatuh. Now we would like to present chapter 13, which is disease of the musculoskeletal system and connective tissue. My name is Nur Nabilah binti Azhar. I would like to present the introduction of chapter 13. Chapter 13 of ICD-10 are classified as musculoskeletal disorder, that the condition that occur as a disease process. Injuries that affect the musculoskeletal system, such as fracture, are classified to Chapter 19 of ICD-10, with exception of stress fracture and pathological fracture. This chapter are contained the following blocks of codes: M00 until M99. Musculoskeletal refer to the muscle which hold the body, direct and allow movement, and the bones, which are connective tissue that protect the internal organ and form the framework. There are a few codes that must be understood, which is cartilage, joints, ligament, tendons, synovia, bursa, and fascia. Cartilage is a smooth, non-vascular connective tissue that comprise the more flexible part of the skeleton, such as outer ear. Joint is allowed for bending and rotating movement. Ligament are band of connective tissue that connect the joint. Tendons connect muscle to bone. Synovia is the fluid that act as a lubricant for the joint tendon shaft, and bursa. Bursa is a synovial field that works as a cushion to assist in a movement. Fascia is the connective tissue that not only cover but also support the separate muscle.
Assalamualaikum, I Siti Zulaika binti Muhammad Yani. I will explain the guidelines for chapter 13, which is diseases of the musculoskeletal system and connective tissue. The first guideline is size and laterality. Most of the codes within chapter 13 have size and laterality designations. The site represents the bones, joints, or the muscle involved. For some conditions where more than one bone, joint, or muscle is usually involved, such as osteoarthritis, there is a multiple site code available. For categories where no multiple site code is provided and more than one bone, joint, or muscle is involved, the multiple code should be used to indicate the different sites involved. The next guideline is bone versus joint. Bone and joint infections cause serious morbidity and pose significant management challenges. They may cause acute sepsis with bone and joint destructions, chronic pains, discharging wounds, and permanent disability. With expanding populations and increasing age, bones and joint infections, especially those involved with devices, will have a growing impact on healthcare resources. For effective management, well-coordinated multidisciplinary working is important. For certain conditions, the bones may be affected at the upper or lower end. For example, a vascular necrosis of bone in code M87, osteoporosis in code M18 or M81. Choose the portion of the bone affected, may be at the joint. The site designation will be bones, not the joints. And then lastly, acute traumatic versus chronic or recurrent musculoskeletal conditions. Many musculoskeletal conditions are a result of previous injury or trauma to a site, or recurrent conditions. Bone, joints, or muscle conditions that are the result of a heel injury are usually found in chapter 13. Recurrent bone, joint, or muscle conditions are also usually found in chapter 13. Any current acute injury should be coded to an appropriate injury code from Chapter 19. Chronic or recurrent condition should generally be coded with a code from Chapter 13. If it is difficult to determine from the documentations in the record which code is the best to describe a condition, query the provider. Next will be continued with Nur Atira. Thank you.
Coding of pathologic fractures. 7 character A is used for use as long as the patient is receiving active treatment for the fracture. While the patient may be seen by a new or different provider over the course of treatment for a pathological fracture, assignment of the 7 character is based on whether the patient is undergoing active treatment and not whether the provider is seeing the patient for the first time. Next, 7 character D is to be used for encounters after the patient has completed active treatment for the fracture and receiving routine care for the fracture during the healing or recovery phase. The other 7 characters listed under each subcategory in the tabular list are to be used for subsequent encounters for treatment for problems associated with the healing, such as malunions, non-unions, and sequelae. Care of complications of surgical treatment for fracture repairs during the healing or recovery phase should be coded with the appropriate complication codes. Osteoporosis. Osteoporosis is a systematic condition, meaning that all bones of the musculoskeletal system are affected. Therefore, size is not a component of the codes under category M81, osteoporosis without current pathological fracture. The site codes under category M80, osteoporosis with current pathological fracture, identify the site of the fracture, not the osteoporosis. Osteoporosis without pathological fracture. Category M81, osteoporosis without current pathological fracture, is for use of patients with osteoporosis who do not currently have a pathologic fracture due to the osteoporosis, even if have had a fracture in the past. For patients with a history of osteoporosis fractures, status code Z87.310, personal history of healed osteoporosis fracture should follow the code from M81.
My name is Siti Haja binti Nur Hisham, and I will continue with osteoporosis with current pathology fracture. Category M80, osteoporosis with current pathology fracture, is for patients who have a current pathology fracture at the time of an encounter. The code under M80 identifies the site of a fracture. A code from category M80, not a traumatic fracture code, should be used for any patient with known osteoporosis who suffer from a fracture, even if the patient has a minor fall or trauma. If that fall or trauma would not usually break a normal healthy bone. Next, I would like to share with you guys case study 10 from the textbook. This 46-year-old male carpenter presents to the office today complaining of the pain in his right thigh area, which has increased throughout the day. Exams show no limitation in ROM or reflexes. Skin is intact. Neurological exam is within normal limits. I instruct him to hit the area and to take Tylenol for the pain. He is to return to the office if symptoms do not resolve in 1 week. The answer for this case study is M79.651, which is pain in right thigh. That's all from me. Thank you.
As a conclusion, I will recap of this chapter. Musculoskeletal system are include bones, muscle, tendons, ligament, soft tissue. They work together to support our body weight and help us to move. Injuries, disease, and aging can cause of pain, stiffness and other problem with the movement and function. This chapter contains the following blocks of codes M00 to M99. That's all from us. Thank you.